Thank you, Una, and I am delighted to be here today. Some of you will know me. I'm part of the INMO OHN Conference Planning Committee, and really miss not being able to meet everyone face to face this year. But anyways, it's great to have so many here. So I'm going to be introducing the two last speakers of the morning. So without further ado, I'm going to be introducing my own colleague, actually, Sinéad Cruz. And Sinéad is Head of Health and Wellbeing at Laya Healthcare. As the largest health and wellbeing provider in Ireland, with more than 3,000 health and wellbeing programs running in thousands of companies each year, Laya Healthcare is dedicated to empowering our members and enabling employers work support those who work for them. Leading Ireland's largest team of workplace clinical and wellbeing experts of about 750 across companies of various scales and sectors, including technology, financial services, pharmaceutical and manufacturing. Sinéad has almost 20 years international experience spanning FMCG, infant nutrition, and health and wellness industries. The Great Reset, a brave new era of work and wellbeing, was commissioned by Laya Healthcare this year. This was Ireland's largest ever research among employees and HR leaders into the challenge of the century, which is COVID-19. So Sinéad will share the findings of this research in her talk, and delighted to have you here this morning with Sinéad. Thank you.
Thanks very much, Mary. Can you see me and hear me okay?
Yes.
Okay, thank you, Mary. Thanks a lot, Mary. So what I'm going to do is I'm actually going to share a presentation, and I'm going to do my best to listen to what Alan just taught us about not having a double chin. Any tip to not have a double chin is wonderful, right? So I'm going to do my best to talk to you, to the camera, and listen to those tips. He was really wonderful, wasn't he? As I try to bring up my slides here. So let me just bear with me as I share my screen. So let's see if that is. Okay, so can you all see that screen? Maybe somebody can just say yes or no.
Yes, perfectly, thanks.
Thank you, Jean. Okay. So first of all, on behalf of Laya Healthcare, and Mary, thank you for that introduction. Really would like to thank you for introducing this topic to your conference and inviting us to share the results of this research. I have so much admiration for the work that you are doing as nurses and midwives, whether that's in the workplace, whether that's in a hospital, whether that's in a clinic setting, a nursing home, wherever you're delivering your care. Maybe it's not face-to-face, maybe it's through digital means. We've certainly seen that total pivot to digital through this pandemic since March this year. So what I'm going to do is share with you the findings of this research, which is the largest research that's been done in Ireland, and it's important to realise that this is nationally representative. We interviewed over 1,000 employees in Ireland, almost 200 business owners or HR leaders, and also carried out in-depth interviews across some companies ranging from global multinationals down to small to medium enterprises to ensure that we had a really pan-Ireland national representation for this research. And my hope is that when we go through the insights and the learnings from the research, that you can take away some key statistics or facts, or maybe just you're nodding and you're listening and it's confirming just how important your role as healthcare professionals is. It always has been, but just how essential it's been through the pandemic, and it will continue to be as we advance through living with COVID-19. So I'm just going to go on to the next slide. Why do we do this? Well, as Ireland's leading provider of health and workplace health and wellbeing supports, you may not know that about Laya Healthcare. You might just see it as a health insurance company. We have a provider network of over 750 healthcare professionals that provide workplace wellbeing supports to over 2,000 companies in Ireland. And we do that through our strategic partnerships with Cognate Health in occupational health, with Spectrum Life through wellness, and with Advanced Medical Services as our screening partner. And up until the 12th of March this year, when Leo Varadkar, or then Taoiseach, announced that we were going to go into lockdown from his address in the US, our business almost came to a halt, because up until then, everything that was delivered face-to-face and on-site, or through our clinics. And so we had to really pivot. We had to completely change the way we worked. And I loved actually the fact that Alan spoke just before me. That was quite daunting, you know, you're here now and you're delivering this message. I can't see anybody. Again, I'm not seeing body language, I'm listening to the cues. But you still want to be able to deliver the best outcome for your patient or the person you're caring for. And we had to really think about how to do that differently, both to a remote workforce, but also on site through digital means or in a socially distanced manner. So the pandemic really threw our business into chaos, and we owed it to our companies that we partner with and that we service to really understand what their needs were. And hence the reason why we carried out this research. So here are some of the key findings. I'm just going to see if I can change my screen and just maybe, here we go. Just put that down here for now. Okay. So we have 10 key findings, and I'm going to take you through each one of them, starting with the anxious normal. And for here, this is very important to explain what we mean by anxious normal, okay? There is nothing normal about how we are living right now. We've just come out of a second lockdown. Our social connections have been significantly limited. Even if we are able to go physically and work on site, we've got to wear masks, we've got to wear PPE, we've got to wear gloves, we've got to social distance, we've got to sanitize all the time. We've got to be very mindful that we're living alongside a virus that needs to be contained, and we need to break the transmission of. And our humanity, our keeping in touch is being limited. And that creates an anxiety that is not normal. So our default norm has become an anxious normal. And so what we found in our research is that 39% of employees are struggling to cope. They worry about getting ill or a family getting ill. Now, we carried out this research in July this year, and at the time, we still didn't know whether or not the schools were going to return, whether the restaurants were going to open, whether the government were going to reopen the economy and phase us back to a normal society or a normal economy. And I know once the news of the schools going back was announced, that was a huge welcome relief to many, many people in Ireland, especially those with those parents of young children. So I think that certainly helped. But another anxiety came with that, and that was, well, what if my child gets sick? What if they're in one of those pods where a child that's in their pod or their bubble or their class or their school has been tested positive? What then? And that's what we're living through now as we're coming out of that second lockdown. The next one is the health time bomb. So what we found very interesting was almost a third of people are actually afraid to go and see their GP. So in Ireland, of course, our healthcare system is very much, you go first to your GP, and then the GP refers you on if you need extra care. But almost a third afraid to go and see their GP. And this has knock-on effects then, obviously, for referral onto other care pathways. So interestingly, since March, we have seen a 300% increase in the use of our members of the digital GP service. And this was something I think all healthcare providers wanted, was an embrace of digital. And, you know, using digital and data as a way to give better outcomes to patients and better care or more effective care. But there was always a reticence because, of course, you want to be giving care face to face. But seeing that digital could enable that delivery of care to a GP and that continued referral on for further care was really fantastic to see. And up until the latest data that we see on that, so the latest numbers from November, we continue to see that 300% increase versus the pre-pandemic figures. So that's very, very encouraging to see. And I think people are embracing it. The next is the vulnerable third. So this is very important to define that this is self-declared people who are telling us that they have an underlying health condition. So whether that's asthma, diabetes, they're immune compromised, they have an underlying heart condition, they are feeling that they're more vulnerable to COVID-19. And as we heard from Professor Mary Horgan, of course, one of the physical manifestations of having COVID-19 is that increase, that big increase in inflammation. Many of these underlying health conditions are already inflammatory driven types of health conditions. So these people are even feeling more vulnerable. And that's something employers need to consider, of course, when they're listening to their employees, and they might be a little bit reticent about going back to the office if they've been working remotely, or they may just need that extra care. The next one is the need for help. So for us, this was very important. You know, a third of people feeling anxious frequently. So just to be clear, and again, there is a full report on this, which is available for everybody. You don't have to be a Laya Healthcare member at all to access it. But 9 out of 10 people feeling anxious, which is why we termed it the anxious normal. But a third of people feeling that frequently or all of the time. Okay, but only 14% reaching out and getting that help. And that doesn't necessarily need to be with a healthcare professional. That could be reaching out to someone you trust, a colleague at work, a family member, a trusted friend. Maybe you have a very good relationship with your manager, but you're not in 1 out of 3 cases actually, so 14% of that 31%, not reaching out for help, which is not good. So we certainly see, if we look at our employee assistance program, it's our 24/7 mental wellbeing support program at Laya Healthcare, we see a steady increase in the use of that service since August this year. So we didn't see a lot of an increase from March to July. I think people were starting to try and get used to this way of living and working, and I don't think they realized, I don't think any of us realized that it was going to go on for so long. But now that we know that this is our reality for now, and yes, the vaccine gives us great hope for next year, but we need to remain vigilant. We will continue to feel this anxiety. People are starting to reach out for help, and that is wonderful to see. And the 5th one on this slide is the pearls of isolation. So this is where we know it's well written in the literature that isolation and that lack of social connection can be twice as impactful on our health as obesity. And this is certainly something we're seeing through the pandemic. 40% of people saying no interaction with colleagues is the biggest challenge for them in working remotely. So that's something they really, really miss, that social interaction, and that's something that we need to be mindful of. So moving on to the second 5 insights or key findings from the research, the death of the commute. So this was by far the most positive reason for people working remotely through the pandemic. They said, my God, especially those actually working in rural areas where they may have had over an hour, I think it was on average 1.5 hours commute time. They were getting back 3 hours in the day that they could spend with their family or doing something that they really loved, working on their fitness or just being at home more or doing other things. So the fact that they weren't in the car commuting, this was something that was hugely positive for them. And only 26% wanting to go back working full-time on site. Interesting, this morning in the Times, there was an article referring to the recent CSO results, that a survey that was conducted in November, showing again, confirming these figures, that it's only really 1 in 5 people wanting to go back full-time to the workplace, and 6 out of 10 wanting a blend or that hybrid model of working remotely and on site, which is also what we see coming through the research. Obviously, in some jobs, if you have to physically be there, that's not going to be possible. But in those jobs where there is a level of office-based work or administration, you know, there will certainly be an appetite for employees to continue to want to have that blend of being able to work remotely, but also being able to go in to the office or into the workplace, but not full-time. The seventh insight is a fear of a second surge, and we actually lived through that, and we've just come out of that lockdown. So at the time, 45% of employees not confident that their employer was ready, and we certainly saw that coming through again with some of our clients. Higher anxiety, higher requests for mental health supports and educational seminars, particularly for managers, in helping them deal with employees that were struggling more through this second lockdown, because they felt that they weren't getting the support that they needed from their employer. And that depends on the, I suppose that really depends on, you know, the personal stage of that person. So if it's a parent, they may favor much more a flexible working arrangement than, you know, having fun wellness activities being provided by their employer. If you're a millennial or a Gen Z, you might not need that flexibility. You may not be dropping kids to school, or you may not be on call if a child is sick. So you might favor being able to access a digital gym, or being able to do your yoga class, or indeed having some time for those water cooler moments, or checking in through coffee breaks, and being able to build that into your work. So really understanding how you can support people as they feel anxious or normal, that's been a really important finding from the research. A wellspring of trust. So this is where, you know, from an employer point of view, that's where it all starts. So ensuring you have that trust between an employer and employee, that they're really aware of what's happening, what the supports are through COVID-19, that the communication is clear, that the employee is clear, but the employer is also clear. Once you have trust, that builds engagement. Once you have built engagement, then you have performance. Without the trust, you don't get the other two. So that's the critical first step. The shrinking office. So this is where we call this the Great Reset, a brave new era, a wonderful opportunity for us to rethink work and the workplace and what the future of work is going to look like. So if you do have more people wanting that hybrid or that blended model, and we see that 60% wanting that, the office space you require may not need to be as large. What is now the role of the office? And digital health and wellness resources becoming a vital tool in supporting remote working. We actually see from some of our North American multinational corporate clients that we partner with for their health and wellbeing needs, a lot of their employees who are non-nationals, so they have very diverse employee base, some of them up to 60 nationalities. Working from home for them means that they have returned home. They've returned home to Spain or Portugal, Middle East, some in the States, some further afield. So we've had to really think about how we continue to service their health and wellbeing needs and still have that through the lens of the Irish legal framework, because technically their contracts are in Ireland, but they may be working from a country which has a very different legal construct. And so all of that has to be taken into consideration in terms of what they're living with, what restrictions they're living with, and how an employer can support them through health and wellbeing. And then the final one, I think everybody is saying this today, but it's absolutely critical, is the importance of clear and simple communication, simple messaging. 39% don't think their employer's wellbeing strategy is effective. So that's 4 out of 10 people who feel that the communication about the supports that are in place to really carry out that duty of care is not strong enough. So, you know, from an occupational health point of view, I think that's a wonderful, wonderful opportunity just to show how important that resource is and how important the wellness of employees is to first build that trust, then get that engagement, and then ensure productivity and performance. So certainly an opportunity there for development, I think. So after our research, and publishing the report, which was released in September, we also worked on providing, I suppose, educational booklets for employers and HR leaders to, again, bring home the importance of implementing these results. So the first one was in prioritizing well-being. And this is where we developed a framework for communication and the importance of communication. We called it our CARE framework. So first communicate, then anticipate, respond, and engage. So whatever your workplace situation, whether you're in a manufacturing site, you're in a hospital, you're in an office-based environment, or as Alan said, you're working for a tech company, you've got your hoodie up and you're coding, really be clear with employees what the here and now is, but what also the future plans are for the workplace in terms of living alongside COVID. And then anticipate the risks that are associated with that new way of working. How are you risk assessing for COVID-19? What supports are you putting in place? How are you controlling, tracking, and tracing positive cases? What type of PPE is required? But also think about the humanness and the holistic health of that person. If they're working remotely, how are you risk assessing now for ergonomics? How are you risk assessing the psychosocial risks of isolation? How are you ensuring that connection? So trying to anticipate the risks that employees are faced as their workplace has completely changed and shifted from what they've known. The next one is critical. You communicate, you listen, now you need to respond. And the strength of the response is really going to be what develops that trust. Okay, so think about that visualization, that trust between the employee and the employer. And finally, that drives the engagement, and it's ensuring that this is maintained and that engagement is continued, because of course the communication from the government about COVID-19 is changing all the time. And now we're thinking about this vaccine and what that means. So that's going to be the next step. The next one is tackling fear and fatigue. And we actually launched this in just towards the end of October. And it was quite interesting because at that time, we were seeing the numbers soar and people were getting really anxious. And those fears that we had seen in our research, that 45% of people who were afraid of a second surge or fearful that their employer wasn't ready for it, these were being realized. So this booklet was developed to really support, again, the employer, but also the employee in understanding how to tackle that fear and that fatigue. And the fatigue, what was coming through really, really clearly was this. It was more in the remote working. The fatigue was around constant WebEx, constant Zoom calls. Even socializing is through a Zoom. We can't connect. We're just tired of the digital. We're tired of sitting down. And, you know, again, great to be reminded by Alan that you don't have to sit down. You can get up, you can move. You're listening to me now. You can have your music on. Maybe you can't hear me though that well if you have music on, but you can be dancing away. You can be doing whatever you want to do. You don't have to be sitting down. So even though you're using digital, not to be a slave to it, and to also think about the different types of ways you can connect with technology. So sometimes it's best just to pick up the phone. Why not go for a walk while you're phoning somebody? So really to keep mobile, and also to keep nourished and hydrated. That was really, really important. To remember employees' needs and fears, and to build trust by sharing plans. So again, continue to communicate clearly if things are changing, if you're creating new policies, if you're creating new health and wellbeing supports, to continue to share those plans. Future-proofing health and well-being. So this was the latest booklet that we released. And again, this coincided with the news of the vaccine. So it's, great hope. We're coming to the end of a very, very, very tough year, but the vaccine brings great hope for 2021. And the hope is that we leave 2021 in a much stronger, resilient place. But the continuation of supports for health and well-being will still be super, super important. And these are actually the 5 key areas that people really were reaching out to look for support in. And they're all in the area of mental health and well-being supports. 34% requesting stress management tools, 29% mental health training, 27% information on mental health at work, 24% access to counselling, and 24% access to meditation. So really this importance of being able to disconnect, being able to recharge the batteries. One of the alarming statistics that we found in the research was from March to July, almost 90% of employees had not taken any holidays. And there was a huge reduction in those taking sick leave. Now, for the sick leave part, that might have been, the fact that people aren't physically interacting with each other, so they're not spreading viruses as much, they're not as sick, they may not be as stressed because they don't have to struggle with that work-life balance as much, maybe they have more time. But there's also the downside to that, which is they may not actually be phoning in sick. They may not be having regular check-ins with their managers. They may actually be sick, but they're not reporting it, okay? So that was also something just to bear in mind in terms of risk assessment. And then the final one, I think I'm actually running over by 2 minutes, but I'll just end here and then one slide after just to finish up the talk. Fostering Resilience will be released, I think it's next week. And that's the key thing, to keep that realization that we don't have to say we're in this for the very long haul anymore. The vaccine does bring great hope, but we need to remain vigilant, and we need to keep that resilience and be mindful that we're all in it together, and we do need to care for each other, but we're all individuals. So, we need to ensure that everybody's voice is listened to and that everybody gets the supports they need, whether they're vulnerable, they're cocooning, they're anxious, they're a parent, they're a young millennial, or they're a manager that's struggling to lead during these times. So I think the key takeaways really are that this is not normal. So the norm is this anxiety, and really making sure that that's being addressed. The future of work will never be the same. So even if you do go back to the workplace, having not been in the workplace since March, I'm one of those people who has not been to the office since March. Even when we do go back, we know it will be very, very different at Laya Healthcare, just like many, many other companies. And the future delivery of digital health and well-being will absolutely be digital if you do want to ensure an inclusive workforce that is diverse, that is a real blend of on-site and remote. So thank you very, very much for listening. I do hope that you found that useful and that there were some insights there that you can use in your own work to support how wonderful and important your roles are. And to get more funding to do greater healthcare and ensure best outcomes and really ensure a health resilient Ireland. We are, I don't know, Mary, I'm very happy for the report to be shared for anybody who wants it through this forum, or you can download it on the layahealthcare.ie/Brave New Era page on our website. You can also access the 4 booklets there. Thank you very much for listening.
Thank you, Sinead. Thank you very much. And lots of interesting statistics. And we know, yes, certainly the research was done in July, but however, we're still seeing all of these real issues still coming through in industry, you know. So we haven't got too many questions. However, I have one question here that I maybe could ask that has come through. So it's talking very much about, okay, the pandemic will have a long-term impact on mental health. And how do we support staff who are struggling when we can't meet with them face to face? And I suppose that is very much, I suppose it is said, as we continue to work in this environment for long periods, you know?
Yeah, I think that's a really good question, Mary. So I think the first thing, before we start talking about supports and policies, the first thing you have to think about is how is that person being communicated to on an individual level? Is their manager meeting them regularly? Are they meeting colleagues regularly? That's the first thing. So are they getting regular contact through phone, through meetings, through check-ins? What is the governance like in terms of that individual person? And then you look at the company culture itself. You know, is it a company culture of care? You know, are they allowing for are they allowing for people to be able to come forward and express if they're having concerns, if they're having difficulties? Then the next bit is, are the managers actually trained to be able to help people in these remote working areas? Do they have an employee assistance program? Do they have occupational health supports? If they don't, do they know how to access them? Do they know when to refer to them? And then from a leadership point of view, is there actually a health and well-being strategy in place? You know, is it front of the agenda? Are the investments and, let's face it, KPIs in place to ensure that companies are carrying out their duty of care and they are helping, especially from a mental health point of view, with their workforce during this time? So I think I would start, instead of going up and starting with the strategy and working down, I think you need to first look at, well, how are these people supported on a one-to-one basis in their work, and then work all the ways up.
Thank you, Sinead. So that's it. We haven't got lots of questions for you, so you're off the hook. And so again, look, it was hear all of these details, and certainly, yeah, as such, I think there's lots of statistics that we can bring in as occupational health nurses, bring back to our colleagues and teams and into businesses. So thank you again for your support and participation.
You're very welcome, Mary. Thank you very much.